Hi, my name is Mitchell Levine. I'm with the Nassau County Emergency Medical Services Academy. I'm going to demonstrate Skill Station 1B of the New York State Practical Examination for Emergency Medical Technicians. Patient assessment for the trauma patient. I'm going to verify how many victims there are. I'm going to verify that the scene is safe, and I'm going to assess whether or not I'm going to need any other ancillary support. As I get on scene, I give my general impression of a male, approximately 60 years of age, lying in the middle of the street. I instruct my additional EMT to maintain manual cervical spine stabilization, at which point I begin my AVPU evaluation. He's non-responsive to my being here, at which point I go, "Hello, sir, can you hear me?" And he responds to me, therefore he's verbally responsive, and at this time no need for an airway adjunct. I'm now going to assess the patient's B for breathing. Auscultating upper right clavicular. Sir, can you take in a deep breath? Upper left clavicular. Sir, can you take in a deep breath? I assess equal rise and fall of the patient's chest. And if necessary, I expose the chest to look for any other injuries, such as a flail chest or an open sucking chest wound. At this time, I make a decision for oxygen therapy based upon my findings, and I apply a non-rebreather mask set at 15 liters per minute. I'm now going to go on to the circulatory evaluation. I'm going to check for a radial pulse. If I did not find a radial pulse present, I would check for a carotid pulse. They both appear to be intact. I'm now going to check for skin temperature and color, and I make note of that, as well as checking for major signs of external bleeding in 3 of the voids. Fingers going all the way in, fingers going all the way out, up and down through the body. Based upon my ABCs, I'm now going to make an impression as to my decision for transport. Is it a rapid load and go, or is it a stay and play? For this scenario, I'm going to consider this to be a stay and play. At this time, I'd like to continue with the sample history. I want to find out what his primary symptoms are. I'm going to find out if he is allergic to any medication. I'm going to ask him what medication he may be taking. I'm going to ask about his past medical history, including cardiac, respiratory, diabetes, hypertension, and seizures. I'm going to find out when he ate last, and I'm going to ask him questions related to events leading up to the incident. I'm going to ask the patient to look straight at my nose. I'm going to check his eyes, coming in from the outside in both directions. Once I finish with the head, travel down to the neck, check for tracheal deviation, and check for the appearance of jugular vein distension. After I finish assessing the anterior portion of the patient's neck, I'm going to check for tenderness along his posterior region of his neck. Once the head and neck are assessed, I'm going to assist my partner in applying a cervical collar. Once the collar is in place, I'm going to continue with my assessment of the patient's anterior chest. Sir, does it hurt here?
No.
Sir, do you have any pain here? Sir, do you have any discomfort or pain here? I'm going to assess 4 lung sounds this time. Sir, could you take in a deep breath? Good. Could you take in a deep breath? Thank you. Once again, sir, deep breath in and out, and deep breath in and out. I'm now going to continue to assess the patient's abdomen, 4 quadrants. Any tenderness here? Any tenderness here? Do you have any tenderness here? Do you have any tenderness here? I'm going to check for pelvic instability. Any pain, discomfort here? Any pain, discomfort here? I'm going to make note of checking the patient's genitalia as necessary. Sir, do you have any pain here? Any pain here? Any pain here? Do you have any pain or tenderness here? Any pain or tenderness here? Any pain or tenderness here? Do you have any pain or tenderness here? Do you have any pain or tenderness here? Do you have any pain or tenderness here? Remove the patient's shoe and sock. Sir, can you tell me which toe I'm squeezing? Can you wiggle your toes? And I'm going to check for a distal pulse. Very good. Do you have any pain or tenderness here? Any pain or tenderness here? Do you have any pain or tenderness here? Sir, can you tell me which toe I'm squeezing? Thank you. Can you wiggle your toes? And I'm going to once again check for a pedal pulse. Sir, do you have any pain or tenderness in your left arm here? Any pain or tenderness here? Any pain or tenderness here? Can you squeeze my hand? Can you tell me which finger I'm squeezing? And I'm checking for the presence of a radial pulse. Do you have any pain or tenderness here? Here, 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 or here? Can you wiggle your fingers? Can you tell me which finger I am squeezing? And I'm going to check once again for a radial pulse. To position my patient so I can assess his posterior region. Going to move one arm out to the side. Going to cross his ankles. On my associate's head count, up to 3. I'm going to turn the patient left lateral recumbent. 1, 2, 3. Patient's placed on his side. I'm going to check the back of his head, thorax, lumbar spine, buttocks, and posterior legs. On the count of 3, I'm going to lower him down onto a backboard. 1, 2, 3. At this point, I'm going to secure my patient to the backboard and continue transport to the ambulance for assessment as well as transport to the hospital. At this point, I'm in the back of the ambulance with my patient and my partner. We're going to continue to assess the patient by taking vital signs throughout the ride to the hospital. I'm also going to continuously monitor his cervical spine, his AVPU, and his ABCs, and I'm also going to check on interventions, in this case, oxygen therapy and backboard spinal immobilization. I'd notify the hospital of what we have coming in and our approximate estimated time of arrival. And that concludes the New York State practical exam skill.